Hello, I'm Dr. Clayton, and your physician has asked me to explain to you part of the healing process that is occurring inside of your body right now. It's called the phases of healing. As soon as the body is injured, whether it is an acute trauma such as a whiplash injury or something that occurs gradually over time such as a repetitive stress injury or even a slip and fall, the body begins to heal in a predictable fashion. Immediately after the injury, the body begins to bleed. Then it starts to inflame, and then it starts to lay down a collagen foundation for the repair process. Let me show that to you. As the muscle is torn, the bleeding occurs. The body starts to lay down a collagen fiber foundation. What your doctor's goal right now is to reduce the bleeding, reduce the swelling, prevent re-injury, and reduce your pain. Very quickly, the body slips into what they call phase 2. And this is where your doctor's goal changes from just getting you out of pain to helping the collagen fibers line up properly. Along the way, he's going to be giving you recommendations for exercises, home ice, restrictions in activity. All of these must be paid attention to very carefully. Those recommendations are not given lightly, and they're given based upon how the body heals, your specific case, and his personal knowledge and skill on how to treat your injury. After the body lays down this loose collagen foundation, the tropocollagen is what it's called. The body then starts to lay down collagen fibers in various directions, illustrated this way. These collagen fibers orientate in a very haphazard fashion. By specific spinal manipulation, exercises, physical therapy, the goal is to line those fibers up along the axis of the muscle. As time goes on, the primary goal is no longer just pain. In fact, by phase 3, you're probably out of pain. The goal now is to strengthen the area in order to prevent re-injury. Every doctor that I've ever treated, have studied under, or worked with have agonized over the people who have re-injured themselves because we were not allowed to bring the case to strength. This will be done through some further treatment and some further refinement of specific exercises for you to do based upon your specific case. If we do this right, what happens is the collagen fibers lie down, there is stretch and strength given to it, re-injury is minimized or eliminated, and then you'll be able to be released based upon the recommendations of your particular physician, based upon your particular case. However, there are some complicating factors, and they can get to be big complicating factors too. I have here a list of 22. I'd like to go over them with you so that you can see some of the reasons why your case might not recover as quickly as you would like. If this was an auto accident, we have to consider the possibility that if you were not aware of the accident, that your ligaments might have been stretched a little bit more because the muscles were not able to guard you from injury. Again, in auto accidents, body position, a double impact, a wet surface, seat belt and shoulder harness, although designed to save your life, many times holds the person in place so that the entire injury mechanism is focused to the neck. Now, you didn't put your head through the windshield, but there's extra strain placed upon the musculature so that a simple 15-mile-an-hour rear-end accident could actually be more serious than you think. If the surface is wet, You must understand that the car was able to glide and move quicker, and thusly the physics of the action is quicker, and the injury could be more severe than you would think. Other complicating factors are severity of injury. If the patient's in a lot of pain immediately, this can complicate the recovery. If there's a head injury involved, was there an immediate onset of symptoms versus it occurring over a gradual period of time after the initial trauma? Severity of pain and disc involvement also complicate the case. Other complicating factors are things that you had control over but perhaps had no knowledge of. We have everything from delay of onset of treatment, you thought it would go away, deconditioned health. Perhaps you're not as healthy or as young as you would like to be. Degenerative joint disease. Are you a smoker? Age, diabetes, or other systemic conditions. Prior injuries to the same body part. And here's the one that most of us don't like, failure to follow through on treatment. It's possible that you even applied inappropriate treatment to yourself. Maybe you went to bed for a couple of days and you should have been moving around. Perhaps you slept on a hot pack for the last 3 weeks. It is possible through inactivity or even early aggressive rehab, two ends of the same spectrum, could contribute to your slower recovery. Your physician who's going to step into the room and talk to you about your case is going to treat you based upon his knowledge of how the body heals. I hope this information has been of help to you. If you have any questions, your doctor will answer them for you. I'm Dr. Clayton. Thank you very much.